Welcome to the General Data Protection Regulation GDPR online course. Module 6 consists of 3 lessons. Lesson 1 utilizes the case study Technical and Organizational Measures for Protecting Patients' Data by Healthcare Providers and presents the technical and organizational measures as a healthcare provider should take to keep the patient's data safe. Lesson 2 explores secure access and exchange of health data according to the GDPR. And finally, Lesson 3 explores the transfers of personal data to third countries or international organizations. Now we continue to Lesson 1. Case study Technical and Organizational Measures for Protecting Patients' Data by Healthcare Providers. The lesson objectives are understanding the technical and organizational measures for protecting patients' data by healthcare providers. This lesson will help you to better safeguard patient privacy, reducing the risk of unauthorized data access or breaches, acknowledge the importance of ethical data practices in daily healthcare activities, seek further collaboration with data protection officers, IT professionals, legal experts, and stakeholders to ensure data protection and compliance. Scenario: a large hospital network consisting of several medical facilities is responsible for handling and processing a significant amount of patients' data. The hospital network is committed to ensuring the confidentiality, integrity, and availability of this data by implementing appropriate technical and organizational measures as mandated by data protection regulations. Technical measures. 1. Access control. The hospital network employs strict access control measures to ensure that only authorized personnel can access patients' data. This includes implementing user authentication mechanisms such as strong passwords, two-factor authentication, and role-based access control. Access privileges are assigned based on job roles and responsibilities, limiting access to personal data to those who require it to perform their duties. 2. Encryption. To protect sensitive patient information during transmission and storage, the hospital network implements encryption techniques. This includes encryption data in transit using secure communication protocols such as transport layer security for electronic health record access and encrypting data at rest in databases or storage systems. Encryption helps to prevent unauthorized access to patient data even if the physical or digital storage medium is compromised. 3. Data minimization. The hospital network follows the principle of data minimization, ensuring that only the necessary personal data is collected, processed, and stored. Unnecessary or excessive data is not retained, reducing the risk of data breaches and unauthorized access. The hospital network can effectively manage and protect patients' personal information by collecting and retaining minimal data. 4. To further protect patient privacy, the hospital network applies anonymization or pseudonymization techniques to personal data whenever feasible. Anonymization involves removing or irreversibly de-identifying personal identifiers, making it impossible to link the data back to the individual. Pseudonymization replaces direct identifiers with pseudonyms, allowing data to be linked internally but requiring additional information to re-identify the individual. The organizational measures include 1. Data protection policies and procedures. The hospital network has established comprehensive data protection policies and procedures that outline the steps and guidelines for handling patients' data. These policies cover aspects such as data access, data sharing, data retention, and breach response. Regular training sessions and awareness programs are conducted to ensure that employees are familiar and adhere to these policies. 2. Staff training and awareness. Recognizing the critical role of employees in safeguarding patient data, the hospital network provides regular training and awareness programs on data protection and privacy best practices. Staff members are educated about their responsibilities, including maintaining confidentiality, handling sensitive data, and reporting security incidents promptly. Staff training and awareness help foster a data protection culture and ensure that employees are equipped with the knowledge and skills necessary to protect patients' personal information. 3. Incident response and breach notifications. The hospital network has a robust incident response plan in place to address potential data breaches or security incidents promptly. This plan includes defined procedures for identifying, containing, investigating, and mitigating breaches in the event of a breach. The hospital network follows applicable legal requirements and promptly notices affected individuals, regulators, and other relevant stakeholders. 4. Regular audits and assessments. To ensure ongoing compliance and the effectiveness of technical and organizational measures, the hospital network conducts regular audits and assessments of its data protection practices. Internal or external auditors evaluate the security controls, policies, and procedures in place, identifying areas for improvement and ensuring that the organization remains aligned with the applicable data protection regulations. 5. Third-party vendor management. The hospital network assesses the data protection capabilities of its third-party vendors, such as cloud service providers or software vendors, before engaging their services. Contracts and agreements include provisions to ensure that vendors handle patient data securely and promptly with data protection regulations. Regular monitoring and reviews of vendor compliance are performed to mitigate. Questionnaire. Please proceed to test your acquired knowledge with the following questionnaire. Thank you for participating in Module 6, Lesson 1.